Hi, my name is Amy Simcoe. My son Hayden was a patient in the Vision Improvement Program. Jamie was his therapist. And I want to tell you a little bit about what vision therapy did for my son and for our lives. When we first started exploring what was going on with my son, we noticed that we saw some things that we thought maybe vision therapy could or could not help with. We had been through several years of physical therapy and occupational therapy, and we weren't seeing the results that we wanted to, and the things that he was learning, those skills were not sticking. So we went to see Jamie for an evaluation, and we noted some things. My son was very clumsy, bumping into walls, tripping pretty much over nothing. Stairs were a major challenge for him. He couldn't tie his shoes, ride a bike. He had trouble pouring anything without spilling it all over. When he would read, he would tire very quickly. His eyes would become kind of watery and red, and he would rub them, and he would squint when he was watching certain things. When he was reading, we would notice he was also skipping sentences and small words like I or as. And he would sometimes reverse words, so the word was would become saw, or vice versa. He would also sometimes repeat sentences thinking that he hadn't read it yet. He couldn't ride a bike. His movements were not very well coordinated, and he could not tell his left from his right. He had a lot of reversals when he was writing. He had B's and D's and P's and Q's that were reversed on a regular basis. And it was quite concerning. We would take him to the playground, and he would prefer to sit and play with the wood chips because the playground equipment was intimidating to him. He didn't have the visual skills to master that. So he just wasn't comfortable when his friends were playing. He would sit aside. So one of the first things we noticed was that Hayden started to have less accidents. He would not trip as much, he wouldn't bump into walls, and just about maybe 3-4 weeks in, he started saying that things were popping out at him, which we figured out meant his stereoscopic vision was starting to come into place for him. He was able to see things in 3D, and that seemed to be the start of his improvements in terms of skills. So he started to learn how to tie his shoes, which he can now do without a problem. He also started to actually want to pour things, so he was able to start learning how to pour milk and cereal and basic things to help with self-care. He even started to be able to brush his teeth better and figure out how to floss his own teeth, and his movements started to gradually get better and better. Hayden gained the skills he needed to be able to navigate stairs much more easily, so he could actually walk up and down them without going very, very slow and without the fear that he had before. He had the visual skills to now recognize the movements he needed to make to get up and down those stairs without the fear. One of the things with Hayden and vision therapy was that Hayden has what's called a fourth nerve palsy in his right eye, which means it's very difficult for his eye to turn in and down on the right side. So going into vision therapy, we knew there was a risk that it may not be as successful for him, but we actually were successfully able to expand the angle in which he's able to successfully turn his eye and have the eyes team together and work together appropriately. And that was a huge deal because one of the things I always feared was there's going to come a time when he's getting into a car, and I didn't want him to have visual issues with driving. So that's been a huge improvement. His eyes now seem to stay together at all times. Usually when he's sick or tired, we might be able to see a little bit of the misalignment come back into play, but in general, they look great. Hayden's reading also took off with vision therapy. He started to actually pick up books for enjoyment. When he was little, he was an early reader and he loved to read, but as the text got smaller and closer together, it became such a struggle that his love of reading seemed to diminish. But over time, with vision therapy, he started to enjoy it again, and he would pick up books and start to read chapter books, and he would go for longer and longer periods of time. He wasn't tiring out as quickly, and his eyes weren't red and glossy, and he wasn't rubbing them, and it was actually an enjoyable activity again. Hayden was making a lot of little errors when he would read. He would skip the sentences or repeat the sentence, or he would reverse a word, and we saw those things diminish with vision therapy. We noticed that he was able to keep track of where he was at, and he was no longer reading the same sentence again or skipping and trying to figure out what he had just read because he had skipped a whole section. And his reversals of words went down as well. When Hayden finished vision therapy, we felt that his visual skills were cemented in, and we felt that it was a good time to try occupational therapy. And with that, we noticed that right away there were great skills that were sticking with him this time. And one of the things that he learned to do was ride a bike without training wheels. So he can do that now. We also noticed that the skills he was taught at OT this time stayed with him because he was able to use his visual processing correctly, and he was able to learn how to climb and do other things that before had been a challenge for him. Prior to vision therapy, Hayden struggled immensely with catching and throwing a ball. It was something that I think he noticed, and he actually thought was kind of a funny thing because he realized he would constantly miss the ball. But now that he's been through vision therapy, he is able to throw and catch a ball without problems, and that's a great skill for him, and he really enjoys doing that still today. With the help of VT, Hayden now also likes to play on the playground with his friends. He climbs up and slides down, and he's no longer the kid sitting off to the side playing with the wood chips. I also want to share that as a child, I had a muscle imbalance in my eyes, and at 2 years old, my parents chose to have surgery for me, and although they corrected my eyes from a cosmetic perspective, my eyes don't work together very well. And as my son was going through vision therapy, it was very difficult for me to do the exercises that he quickly became able to do. So as a prior patient of surgery to correct a visual misalignment, I highly recommend vision therapy both before and after, if in fact surgery is needed, because it would be a great service to have those eyes trained to work together before the surgery, so that after the surgery, a little more vision therapy can get them working together instead of just looking like they're straight.